Last fall, Pennsylvania Auditor General Eugene Depasquale said the state's child welfare system was broken. Last week, he offered up ways to fix it, but how willing are lawmakers to get on board? Depasquale joins us now with his thoughts on the Fox 43 Capitol Beat. As always, thank you for joining us. It's been described, the state's child welfare system, as state supervised but ultimately county run. And when the counties run out of money, that's where the problems arise. So you mentioned last week $90 million is what it's going to take to fix this. First, how did you come up with that $90 million total?
It basically is existing spending. It's already taking place, but we think it is better directed if it's coming from the state as opposed to from the county, because what we're seeing is counties aren't able to fill a lot of the vacancies, and that's where the trouble really starts at the county level, because then when they don't fill their vacancies, more work onto the caseworkers. Now some caseworkers are working on 30 cases. It's just an impossible task.
You said existing money, so basically money reappropriated from other places?
Well, instead of spending it coming from county property tax level, I think it should come from the state budget, that $90 billion. So when you think about overall state spending in Pennsylvania, it wouldn't be new money, but it would be just coming from a different source.
How willing, though, for example, the governor's office. Have you spoken to the governor's office about this, and how willing are they to kind of get on board with this?
The day before we released the report, the governor and I had a private discussion, but I mean, I told him that the $90 million was going to be in the report, and what he said to me, and maybe if he ever gets asked about it publicly, but this is no secret, he said, where are the priorities? We have to figure out as a state what our priorities are, and if this is a priority, they'll find the money.
Well, you mentioned priorities specifically with this, and you mentioned 28 recommendations. It's a wish list, and working in Harrisburg, that not every wish on a wish list gets granted. So when you're making those tough decisions of what you want at the top of that wish list, what is it? What needs to get fixed more than anything else?
I think a couple of things. Number one is all of the vacancies that exist in the child caseworkers, they need to be filled. That's where the $90 million comes in.
How many vacancies are there?
There's a couple. There's hundreds all over the state.
Okay.
And so when you get to that level, that's what leads to, like in your county, 90% turnover. In other counties, 70, 80% turnover. Caseworkers trying to work at 30 cases. So we think the caseload needs to come down to about 10 cases per caseworker. We think that is a manageable number and leads to better protection for children. So that's where the $90 million comes in. Get that caseload down from around 30 down to around 10 to 15. We think those two things would have a dramatic impact on child protection across Pennsylvania. And third thing is we still have to tackle the opioid addiction, because so many of these problems are coming from parents or the ones that are caring for these children having drug addiction, and many of these kids are then left on their own. We've got to change that, so tackling that from the root cause is a major way to address child protection as well.